Today we are here with our Center Director, Christina Corvalon. We will be discussing primitive reflexes. Christina, what is a primitive reflex?
A primitive reflex is a reflex that we are all born with that helps us to protect ourselves and meet our basic needs as our brain is developing. We're born with basically a brainstem and a budding brain. We need help from these reflexes to help us to survive as our brain develops.
How do they become inhibited?
We should inhibit our primitive reflexes by about the end of the first year of life. Primitive reflexes become inhibited as we take in more and more complex sensory input when we're an infant. As each level of input increases, our bodies and our brains start to work together, and our brain starts to realize that we're able to make those conscious choices. And so it basically puts the reflex to sleep at that point, which is what we call inhibited.
What happens if they don't become inhibited?
When a reflex is not inhibited, we refer to it as a retained reflex, which means you still have the active reflex. If you don't inhibit your primitive reflexes, it can cause a variety of issues as you're developing and growing further, like a lack of coordination. It can cause anxiety, lack of focus. A great array of symptoms can arise when we retain our primitive reflexes.
Can you give 2 examples of reflexes you would look for in children and the specific difficulties that can cause if they're still inhibited?
Absolutely. 2 of the reflexes that we test for are the palmar grasp and the Morel reflex. The palmar grasp is a grasp reflex that you have as an infant, and if it is not inhibited by the end of the first year of life, eventually you may see issues with things like poor penmanship, poor fine motor skills, poor manual dexterity of your hands. The Morel reflex is our fight or flight reflex. When you startle an infant, you see them jump and then they often cry right afterwards because they exist until this reflex is inhibited in a mode of fight or flight. The most common thing that we see with Morel reflexes that are retained is anxiety, but there can also be bedwetting and other issues of this sort.
How does brain balance help with primitive reflexes?
That's an excellent question. Brain balance helps with primitive reflexes because our program is really comprehensive and focusing on the whole child. When a parent is enrolled in our program, we assess them to determine their primitive reflexes that are retained, and we give them specialized exercises that will help them to, basically with a primitive reflex, you have to use it to lose it. So we'll give them exercises to help them to inhibit those reflexes. And once they're inhibited, barring any traumatic brain injury or any sort of major precipitating event, they will stay inhibited.
Thank you so much.
Oh, you're welcome.